Welcome back to Medicine Through Time. Today, we're covering Victorian medicine, a period that witnessed astonishing advancements alongside grim realities. The Victorian era, spanning from 1837 to 1901, was a time of rapid industrialization and scientific breakthroughs, but it was also a period when disease and poor living conditions plagued the rapidly growing cities. One of the most critical developments in Victorian medicine was the germ theory of disease. Before this, people believed in the miasma theory, which claimed that diseases were caused by bad air or miasmas. This changed thanks to the work of Louis Pasteur, a French chemist who proved that microorganisms or germs caused disease. Pasteur's germ theory, published in the 1860s, laid the foundation for modern microbiology and transformed the way people thought about infection and disease. Joseph Lister, a British surgeon, built on Pasteur's work and introduced antiseptics to surgery. In the 1860s, Lister began using carbolic acid to sterilize surgical instruments and clean wounds, significantly reducing post-surgical infections and saving countless lives. His work revolutionized surgery and made hospitals much safer places. Before these discoveries, hospitals were often dangerous. Surgery was performed without proper sanitation and infection was rampant. In fact, the Victorian era was notorious for high hospital mortality rates, which is why Lister's antiseptic methods were so crucial. The introduction of anaesthesia in the 1840s with chloroform and ether also transformed surgery. It allowed surgeons to perform more complex operations and made the experience less traumatic for patients. Queen Victoria herself popularized the use of chloroform during childbirth, helping to make it more socially acceptable. Despite these advancements, Victorian cities were breeding grounds for disease. The Industrial Revolution led to massive urbanization, and overcrowded, unsanitary living conditions were common. Diseases like cholera, tuberculosis, and typhoid spread rapidly. The cholera outbreaks in the mid-19th century were especially devastating, and they forced the government to take public health more seriously. Dr. John Snow is famous for identifying contaminated water as the source of cholera during an 1854 outbreak in London. By mapping cases and tracing them back to a single water pump on Broad Street, Snow's work provided crucial evidence for the need for clean water and proper sanitation. Public health reformers like Edwin Chadwick also played a vital role. Chadwick's 1842 report, The Sanitary Condition of the Laboring Population, highlighted the appalling living conditions in urban areas and linked poor sanitation to disease. His work led to the Public Health Act of 1848, which began to address these issues by encouraging cities to build sewer systems and improve waste disposal. It was a turning point in recognizing that the state had a role to play in public health. Vaccination also became more widespread during the Victorian era. Edward Jenner had discovered the smallpox vaccine in 1796, but it wasn't until the 19th century that vaccination became more common. The Vaccination Act of 1853 made smallpox vaccination mandatory for infants in England and Wales. This led to a significant decline in smallpox cases, though the idea of compulsory vaccination was controversial and faced some resistance. The Victorian era also saw advances in medical education and the professionalization of medicine. Previously, medical training was inconsistent and anyone could call themselves a doctor. By the late 19th century, medical schools and universities were established to provide structured training. The General Medical Council, GMC, was founded in 1858 to regulate the medical profession, ensuring that doctors were properly trained and qualified. Mental health treatment during the Victorian era was less advanced, and many patients were confined to asylums with questionable conditions and treatments. However, some reformers like Dorothea Dix advocated for more humane treatment of the mentally ill, and there was a gradual shift toward understanding mental illness as a medical condition rather than a moral failing. In summary, Victorian medicine was a period of significant transition. From the discovery of germ theory to the use of antiseptics and anesthesia, these advancements laid the foundation for modern medical practices. Public health reforms improved urban living conditions, and the professionalization of medicine made healthcare more reliable. Yet it was also a time when society grappled with rapid industrialization and its impact on health. Thanks for joining me in this episode of Medicine Through Time. Don't forget to subscribe and stay tuned for our next video, where we'll explore medicine in the 20th century and the breakthroughs that continue to shape our world today. See you next time.